Good morning, Dr. Lana Cook. We're going to do a video on pregnancy and chiropractic and why it's so great to have women at any point in their pregnancy or before their pregnancy come in and get checked for if they need chiropractic care and how that could benefit them. So, most of you know that I am in my third trimester, and so it's obviously a topic that is relevant to my mind right now. And I have had chiropractic care, obviously, pre and during my pregnancy. Um, and so, some of the things that I think are really important for someone to think about if they have not heard about the benefits of chiropractic care for the duration of a pregnancy is to first think about what you're trying to do. And when we think about our pelvis, we need the pelvis to be expandable and movable so that the baby can progress through the birth canal without getting hung up, basically. And so, in many of us, from different things that have happened in our lifetime, our pelvis might not be in the perfect position anymore, and that can cause constraints for the baby as far as they're developing in the uterus. And then also as they're progressing down the birth canal, leading to longer birth times, more traumatic labors, that type of thing. And so for many of us, we want to know how do we have the easiest labor and also obviously the best outcome for the baby. And so I think chiropractic from the standpoint of the structure of the pelvis is really important. Then we think about the nervous system and how it plays a role in this. And clearly the nervous system is directing the whole development of what's happening in that woman's uterus. And so again, if we look at what chiropractic offers, it's really about removing the interference or removing the subluxations of the spine or the misalignments that are in the pelvis and the lumbar spine and the rest of the spine in order to have full communication to the rest of the body. Clearly very important when your body's not only conducting your own functions, but conducting the functions for someone else, the growing baby. So again, that's another reason to think about it if you had not pondered options for that as well. There's obviously different techniques that are used for women who are pregnant to make sure that pelvis gets in the right position as the baby is growing and maybe the woman can't lay on her stomach any longer. But those are all things that most chiropractors have knowledge of or are trained in, and you can just ask. Additionally, as you move closer and closer to your third trimester, obviously everyone grows a little bit differently. There's going to be different positions that are much more comfortable for the woman, and that's something too that the chiropractor and you will have to determine as you're growing and progressing through those 40 weeks. Follow-up care is clearly a huge thing that we talk about as well, not only for you as the woman that just went through labor, but then also for the baby. Myself, I was a colicky baby, and so I was lucky to have parents who knew about chiropractic and were already under chiropractic care, and so they took me in, and that was something that I really needed as a newborn infant to stop the crying spells, but it was about the fact that I had misalignments from my birth. So things to think about if you hadn't before, and share this with other women who are currently pregnant or thinking about becoming pregnant. The other thing to think about is if you're having trouble getting pregnant, sometimes it's this interference that's present in the nervous system that isn't allowing the nervous system to conduct properly, and that's why there's trouble to get pregnant in the first place. So all reasons to go in and have your spine checked.